while the state and many Massachusetts communities are still trying to figure out how to handle the legal sale of marijuana, when it comes to the retail aspect of the new law, Holyoke's mayor sees a potential business opportunity for his city. Carolee McGrath sat down with Mayor Alex Morse to hear his thoughts on how marijuana could be a big economic boost for Holyoke.
What are your thoughts on, possibly bringing in different companies to Holyoke?
Yeah, so I obviously supported Question 4 as well as the question to legalize medical use a few years earlier. And I think at this point with the legalization, it's important to take advantage of the potential economic development opportunities that this presents to local cities and towns. And so that comes with both medical and recreational use. The product needs to be cultivated somewhere in the Commonwealth. And so you could cultivate in Holyoke, even if you're dispensing in Central or Eastern Mass. And my argument for Holyoke is, we have an abundance of space. We have 1.5 million square feet of vacant mill space in the downtown, an abundance of water, cheap renewable green energy, and a ready and available workforce to work at the cultivation centers. And so for us, all of these things converge in the city of Holyoke, and it just presents a really great way to both expand our tax base and also create good paying jobs for Holyoke residents.
Okay, so a lot of people might say, this makes me uncomfortable. I know it passed, I know it's legal, but not in my town.
And so, I completely understand concerns of some people. I mean, this is following decades of a stigma of prohibition. And I mean, the facts of the matter are that people have easy access to marijuana as it is. And so what a regulated system allows us to do is make sure that those profits, instead of being put in the pockets of drug dealers in the black market, it's now out in the open, it's regulated, it's taxed, and that those revenues and profits are now benefiting our school systems, our public safety departments, our local communities, our bridges and roads, our public infrastructure. And so a regulated system allows us to both combat with education and prevention the negative impacts of marijuana use, but it also allows us to utilize and take advantage of the economic benefits of it as well, job creation and revenue growth for cities and towns. And almost 60% of Holyoke voters voted in favor of recreational use, a higher percentage for medicinal use, and it passed around the state. And so what I think is important for us to do is obviously acknowledge that it's illegal at this point, and in order for us to move forward, we need to respect the will of the voters and take advantage of the system.
But it's not a secret that a lot of the work that the police do in Holyoke is going after drug dealers, as you were just mentioning. Does this contribute to that drug culture? Does that worry you as a mayor of Holyoke, which has been described by law enforcement officers as sort of a hub for heroin? You're right on the heroin highway on 91. Does that concern you that would in some way impact that?
No, it doesn't. And so we have very few marijuana arrests as it is. And so number one, I think there'll be less exposure to other more dangerous substances when, if you want to use marijuana, you're not going through a drug dealer or through the black market where you have more exposure. It's more dangerous for people of all ages. And then in terms of, I strongly disagree with the argument that marijuana is a gateway drug. And so addiction is a disease. And so of course there's going to be some folks that use marijuana and also go on to use other more powerful substances. But by and large, if you look at the research in those states where medicinal use is legal, you actually see opioid abuse and overdose deaths decrease. And I argue, and I think the evidence is pretty clear, that the biggest gateway drug to heroin, the reason for so many overdose deaths is not marijuana, obviously, but the overprescription of opioids and painkillers that start with an injury. And there's story after story of that happening.
But that's not the biggest problem in Holyoke, though. I mean, Holyoke has had a problem with drug trafficking for a long time. You think that that's the biggest problem with what police are seeing currently?
Well, I think, again, what's the gateway to heroin? And so, there's only so much of a high that people are getting from painkillers before they want to seek something else. And so we don't see people dying and suffering overdose deaths on our streets from marijuana. We see it because of heroin. And so the research is pretty clear as to what, not just anecdotally, but looking at the empirical evidence around the link to wanting to get something more powerful, and that is people can no longer rely on their painkillers and many things. I'm talking to so many people about everything started with a back injury, or even something as simple as getting your wisdom teeth taken out and taking painkillers for that. And so, even looking at the bill that the governor signed and the State House and State Senate approved around battling the opioid epidemic, not one word in that legislation mentions marijuana. And so policymakers and elected officials seem to want to talk about marijuana when it's in a political context, but when it comes to actually preventing addiction and disease, they acknowledge that marijuana isn't the biggest challenge or isn't an issue, to the extent where it's not even included in any prevention
Well,
bill.
some of the doctors that we have interviewed on the opioid crisis would definitely disagree and say it is a gateway. You're starting somewhere. A lot of times they'll say, look, kids are going to start with cigarettes, and then they just move on. They progress from if you have that propensity to alcohol to marijuana. So they say it definitely puts you on a path. But aside from that, other municipalities, are trying to figure out what to do when the retail store is open. Does that concern you at all, as far as, does a retail store open up next to a school? Are they selling edibles? Does that at all make you uncomfortable?
Of course, and it's a regulated system. And back to the gateway component for a minute here, I think what we've actually seen from doctors and medical professionals is marijuana actually being used for folks that are addicted to painkillers and even heroin to wane off of their addiction by using medicinal marijuana. And so doctor after doctor can also talk about the effect that marijuana being less addictive can help people get back to a normal life without addiction. In terms of the concerns around retail sites, we in Holyoke have a very specific zoning ordinance as to where cultivation sites and dispensaries are allowed. And so you won't see one next to a school. When it comes to cultivation, you won't even know really where it is in the city unless you do some research, obviously. And dispensaries and cultivation sites are required to have very comprehensive public safety plans approved by the police chief. And I would argue that it would make the entire neighborhood safer, with security guards, with lighting, with security cameras that wouldn't necessarily be there if it was another industry or business. In terms of edibles, unlike Colorado, the Massachusetts question in particular, and the legislature under medicinal has already banned edibles or things that look like candy or things that would be attractive to young people. And back to my point before, polling has suggested that over 50% of high school-aged young people say that they have easy access to marijuana under the current system. And so young people are using marijuana today. And what a regulated system allows us to do is, again, combat the negative impacts of a system around prohibition and actually educate and talk to young people about the harmful effects of marijuana use in general. And so by no means am I advocating for the use of marijuana. What I'm advocating for is a regulated system that will both prevent addiction and disease, but also in a regulated system that doesn't just benefit drug dealers and people in the black market, but benefits our communities.
What about, you would never invite the tobacco industry to come into Holyoke. Wouldn't that be another job generator? Would that be something you'd be comfortable with?
To some extent. I think it's important to note the differences between the industries and the research around tobacco and some of the other conditions it causes. And again, I don't think there's any conclusive evidence around marijuana being addictive to the extent that nicotine and the substances in cigarettes are. And so I think they're two very different substances, to the point where our Board of Health has actually been very aggressive about smoking cessation programs and prevention, not allowing smoking in public. And what Question 4 doesn't do is allow people to smoke in public. Right. There will be no one walking down the street, on the Canal Walk, or around City Hall, smoking in public parks or in vehicles. And absent legalization, there would not be the entrepreneurial effort we see to develop breathalyzer systems and other mechanisms to detect people driving under the influence. Let's face it, people are driving while high today as it is, and we have no way of knowing. Only in a regulated system will we actually invest resources in developing policies and procedures that prevent that and respond to it, and then take care of it.
All right, Mayor Alex Morse, a very interesting topic, I think a controversial one, but it'll be interesting to see what happens in the years to come.
Yeah, thank you.